Oh man, I didn't even know that part was tight.
Yeah, right here, just a little bit tight too. Hey everybody, it's Dr. Warren with March here in Kalkstein Chiropractic in Towson, Maryland. I'm a chiropractor. March is a golfer, and also you probably have 4 or 5 different hats beyond just a golfer. Working in a lot of different realms. First tee golf is the first thing I want to talk about.
Yep.
Which is where a lot of your heart and energy goes on a regular basis. You're working with people in the community that aren't exposed to the game of golf.
That's right.
Oftentimes children and kids coming into the program in areas where they would never get to hold a golf club, right?
That's right.
Speak to that a little bit as before we jump into working on March's plantar fasciitis. That's where we're going with this.
Okay, so First Tee is an organization where we teach life skills through golf, and we have a few learning centers around Baltimore where we bring the kids there to learn about golf, and we talk about the core values and key commitments that will help them through life.
If you're like somebody watching this and you're like, I kind of want to get my kid involved with this, how do they go about doing that?
So we have a website, firstteebaltimore.org, and we're going to start classes again in the winter. We just finished this week, so as it gets colder and the days get shorter, we move everything inside.
It's year-round. You're supporting this, and oftentimes I just get to listen to March as she speaks about this the passion that she has with this, right? And she gets to follow kids along a journey all the way up to sometimes where they're playing golf in college. So it's super unique. I don't think a lot of people know about it in the golf community. So First Tee Baltimore Golf, it's a nationwide program. So if you're in a different area, just see if there's something near you. And March is a pillar of that community in here. So she's definitely an asset to have if you need to reach out and are curious about it. So shout out to March and what she's doing. That's just one of the jobs she has. She has like 15 other ones. One of them being someone that's an advocate for this office.
That's right. Not a job.
Not a job, but maybe a passion, because a lot of your friends have come in over the last couple of years in terms of you just speaking to what you get in here and what we do. Can you speak to that a little bit?
Yeah, so initially I started coming here because I wanted to start running, and my back was really painful at the time. It's probably from golfing, but I really like how the program helped me, and then the wellness aspect and the fitness aspect with this strength training really helped, and we've really been able to tailor on that to my other activities. So I just keep coming and telling everyone. They always say that I look good and I look mobile, and no one would think I'm a grandma now, but I am, and it's really because of these guys here that have really helped fix me up. So thanks.
Yeah, you're welcome. I love it. Yeah, so she's coming for pain. She's staying for function and for activities and for staying healthy. If I can kind of summarize what that has occurred in her time being here, and it makes a huge difference because she's applying a lot of the stuff that we're doing. She's committed and she's super invested in it from a purpose standpoint, and you can kind of get that real quick with meeting March. So thank you for the kind words, but it's a team effort with us. So we are going to be doing some soft tissue work. March plays quite a bit of golf as well as teaches, and so she's constantly on her feet, constantly moving, and she is getting ready to start. She just started training. Something that she thought she wasn't going to be able to do was to run a half. What's the goal?
Let's start with 5K.
5K, okay. Which is still a lot, especially when you're not used to running. So don't. I think that you just got to take that into consideration when it comes to starting up a program. So we work with a lot of runners in the Baltimore community. Specifically, we have a really great partnership with Charm City Run in the area, and just a lot of their running groups. Members come through here and get treatments. We do a lot of cross training when it comes to runners, but one thing that's really been beneficial for runners that deal with foot, heel, calf pain is Shockwave. So we couple in that treatment along some of the soft tissue work and the adjustments that we do. So March, you're going to see March's treatment with that today in terms of doing some of that soft tissue work and that I do in here. This is ART, it's pin and stretch. I'm going to work both feet, and then I'm going to adjust her full spine as well. So start with the plantar fascia. So coming in and attaches at the heel, spreads out. A lot of times people diagnose themselves with plantar fasciitis. Sometimes they're dealing with more of like a heel pad syndrome, if you will. but there's a little bit of a crossover. So when it comes to me working on the function of this ankle, bottom of the foot, posterior chain, just the way that she moves, I don't stop right where people hurt, okay? But I try to treat more of the function of the leg itself so that it doesn't come back, that we're not dealing with this in 4 months when she drops down in activity a little bit more after we fix it up, because all we did was treatment here. But to start where she does hurt, if you will, we're going to start working on the bottom of the foot, okay? March, go ahead and point at me. Good. And then hang here. I'm going to bring your toes back for me.
Okay.
Good. All the way, all the way, all the way. Good. And then just with your toes curl down. And that's going to be the motion. Okay. You might find some action in there for sure.
Maybe.
Just a little bit. And then straight back. Go ahead. Good. And then just the toes. Perfect. Just the toes. Good. Good. All the way back, all the way back. So what is plantar fasciitis? So the plantar fascia, when it gets irritated, it oftentimes has like kind of a cyclical nature to it. It's very sensitive to overuse or not being used enough. So it can be finicky in terms of when we have it, and kind of annoying, if you will, because you will have pain when you first wake up because it stiffens up while you sleep, and then you'll have it at the end of a longer activity, or you'll have it at the end of a longer day, and it'll be achy in the evening. So it kind of beats you up on both ends. It takes a little while to warm up, and there's short windows or gaps where it just doesn't bug you as much.
That's really a good way to put it, because I'll walk for like 5 or 6 miles on the golf course, and I'll be so tired that I'll just have a rest, and then I'll get up again, and then that's when it really hurts.
Starts to ache, yeah.
So it's okay while I'm being active, but then if I take a rest, then it hurts after.
Yeah.
So I just have to keep going.
And then the other kind of like troubling part about it is that when you try to do something about it, oftentimes we think, okay, I need to move more, I need to have more physical activity, which is totally true.
Right.
But say if someone's like coming in here like March and is like, I just want to, my daughter's running,
Right.
I need a smoker, I need to beat my daughter in this upcoming race.
I don't know about that.
No, she just wants to join her.
She's been in Charm City forever and ever. I just started going there.
There you go. Yeah, there's so more so just joining her, but what happens is they jump into a program and then it starts to flare up on them, so they're very limited. So you try to take a step forward, you get 2 steps back on it when it comes to that kind of approach. So functionally speaking, we try to change the length of the tissue, decrease inflammation. Shockwave is really good at stressing a tissue and bringing about a lot of positive change from a healing standpoint. So it generates that healing mechanism that we have in our body through a healthy stress. So we break down scar tissue with that treatment. We stimulate growth and stimulate change in the tissue. Kind of in that same line, I'm trying to create a positive stretch and mobility in the tissue without hurting it. Okay, bring your toes back, toes down. And then just like the soft tissue is stiff and irritated, I'm gonna go and joint palpate all along the chain to see if there's anything else that's contributing to her foot not getting full range of motion when she walks.
That would be ankles.
That would be the ankles, that would be the knees, the hips, and believe it or not, the core and the low back play a role in that. And if we're really nerding out, we can go all the way up to the arms, but
Jeez.
all good. So posterior tib, go ahead and point at me. Good. And bring it all the way back. And feel a little stretch there. Good. Come back down. And then go ahead again. Good, and back. Relax your leg. Good. And point at me. Good. And then relax. Good. Keep loosening up. Mm-hmm.
I just got John these like gel wraps that you pull on like socks.
Oh,
His ankles.
nice. Gives them a little support or cushion.
It's not as much support as the cold.
Oh, it's like an ice pack in there?
It's like an ice pack sock.
Oh, that's good. I started getting back into the ice plunges.
You did?
Oh, yeah.
After that King Spa?
After the, yeah, exactly. Yeah, I had a session at King Spa, and it's like a cold, hot, cold, hot. It's awesome. And then I went in this like little dojo thing that was like 325 degrees.
Oh my gosh.
So yeah, we had that
That's a
a
lot.
great experience. Went and did a mountain bike trip out in Shenandoah Valley at Bryce Mountain, which was such a cool setup. They did a great job manicuring the trails,
Oh, that's good.
and then came back and did that. So now I'm on the ice plunge game again.
Just jump in your pool.
I did.
Cold by now.
I did. So oh yeah,
It's still open?
I jumped in. I came up and I was like woo, and Layla's sitting there. This is my 2-year-old. She goes woo, starts mocking me. I'm like, I gotta make sure she doesn't try to jump in after me because she's wild enough to do that.
Oh, the middle one.
Yeah, oh my god. We had her last night, just her. My parents took the older Scarlett, and so we walked into town and got a bite to eat and walked back, and she walked for 2 miles.
Wow.
She refused to get back into the stroller. She wanted to go the whole way. She was running and getting so excited. It was sweet.
Wow, you can do ART on her feet.
I work on the kids all the time.
I bet.
Yeah, all the time. Come up, I'm hanging out with them.
You have to bring them to that new Japanese store, Mini Japan.
What's that?
It just opened on Saturday. It's where Urban Outfitters used to be.
They opened something
Oh
there?
my god, it's like this 3-story Japanese convenience store. Well, not really even convenience store, like a department store.
Well, they have groceries and stuff like that kind of
Yeah,
thing?
they have groceries and toys and office supplies and cleaning. I mean, it's like Target, but all Japanese. It's so amazing.
Interesting.
Yes, it's really good.
So you've spent some time in that culture recently,
Yeah.
if you will, visiting one of your kids that's in the military out there. And so you got a little experience with that.
Yeah, so when they opened this store it's called Ibisu. They opened it on Saturday and it was packed, but it was so cool to see that culture here in Baltimore,
Yeah.
right? And in Towson even.
The Towson. Nice.
Yeah.
That space has been empty for way too long too. I'm glad something
Great
came
that
in.
they put that there.
Yeah.
At the very top they have those arcades with the claw games.
They have a little
Stuff
arcade
all
action?
inside. Yeah,
That's like-
those Japanese arcade games.
The Japanese arcade world is is unbelievable.
I know. I didn't even go like in the food section, but it was
Talk about going into a place and feeling like time just stops.
It is.
Hey everybody, this is Mike, back at you from Kalkstein Chiropractic, your local Towson, Baltimore area chiropractor. Today we're going to be doing another focused Shockwave video. So without further ado, let's go ahead and get started. We're going to be doing the calf and the left-sided plantar fascia. So we're going to go ahead and start by palpating around and finding some rougher spots there in the calf, kind of some road bumpy areas, just stuff that you don't really flow as smoothly over. That's a little bit of a hint that we've got some inflammation there, or we've got some fascia of the muscle that just isn't sliding or gliding as properly as it should. So we found a couple of areas here, kind of know we're gonna hit these spots, do a little bit of a spot scan as well, but that quick little palpation pass that I did will kind of show me exactly where I need to start. Now obviously if this gets worse than about a 4 or 5 out of 10, just let me know, okay? We'll lower you back down. That feels pretty light right now, right? Perfect. There it is. You want me to turn it down at all, or are you okay? Okay, perfect.
Wow.
Yeah, it gets a little bit more intense than the radial shockwave, right? Is this your first time getting focused shockwave?
The second.
Okay. What do you think of it so far? Seeing any good results?
I've done both. Yes, it's been great. I got a new treadmill 2 weeks ago, so that's how this whole thing started with the shockwave.
A little more wear and tear than usual.
Now I am up to running after 2 weeks, so that's good.
Are you training for anything specifically on the treadmill, or
Not really.
just
My
wanting to stay
daughters are
fit?
going to be doing some races, and I'm just going to be following along. But then it ends up like I feel like I'm running the races too. Just try to find them.
You're trying to compete on their level, huh?
Not that. Just trying to get a glimpse.
How old are your daughters?
25 and 28.
Okay, so you might have to be training for a little bit to catch back up with them, huh?
Yes. Well, they are good at running, so I'm just trying to get from place to place.
Did they run at school?
They did. My older daughter ran 12 seasons at Delaney,
Oh, wow.
and then she went to the Naval Academy, so that helped her out with all the training that they do there.
Yeah,
She
absolutely.
did marathons and half marathons. And my younger daughter did indoor track in between her lacrosse and field hockey.
Okay, that's cool.
Yeah, so it's always good to be good at running and swimming.
You're not wrong, yeah.
Oh man, I didn't even know that part was tight.
Yeah, right here, just a little bit tight too.
So what does it look like? How can you tell? Like I can tell.
So that passing that I was doing with my hand, anytime we just feel any sort of bumpy structures under the tissue, if we can generally just feel it tight, like I can feel right here's tight on this calf, that's going to be our telltale sign that there's something down there that we need to work out. So we've done a little bit of spot scanning, like you can tell, where we're kind of passing along the calf like so. But a lot of the treatment with the focus shockwave and the radial shockwave is more kind of spot oriented. So we find those spots of inflammation. We find those spots where the tissue isn't quite as functional as it should be, and that's why you can see I'll just kind of stay on those spots. I might play with the angle like so, but a lot of it is just sit on that point of insertion, sit on that tissue that's really being problematic, and just stay there. Okay, so that was our calf treatment. Let me go ahead and just get that calf wiped off for you, and then we will go ahead and start the foot. We're just going to do a quick little wipe off here. So what do you have going on today? You got any plans?
I have a tournament at 10.
Okay.
I kind of hope that this will loosen me up.
Absolutely. How are you feeling for the tournament? You feeling ready?
Pretty good.
Perfect.
Not really anything.
Not really anything to be worried about. I gotcha. Alright, so I'm going to lower back down the energy. If this is a little bit too much, you just let me know again, okay? Is that already a little high, or is that okay?
That's okay.
Okay, perfect.
Yikes.
Just let me know if you want me to turn it down.
Oh, there you go.
You want me to turn it down, or that was the spot?
Yeah, that was a spot.
Okay, perfect. I know right where it was.
Maybe turn it down a tiny bit.
Gotcha.
I keep expecting this to be like the stim.
Oh, yeah. Not quite. It's a little more of a deepy ache sensation than even the other shockwave. Anything down here on the middle part of the foot, or not so much?
I can feel it a little.
Okay. Nothing quite like this spot, though.
Right.
Gotcha. That's definitely a pretty common area of problem with the plantar fascia treatment too.
I have this good foot massager that I put my feet in, but my feet are too small for it, so it's either getting my toes or my heels, not both.
Not the whole foot.
But it feels good. Yikes.
Yeah, that one spot for you, huh?
And I'm always trying to roll out.
We're almost done with our treatment here.
So how is it that it's not like ticklish?
So with the focus shockwave, the energy actually doesn't start, or the energy output doesn't start until several inches into the skin.
Oh.
So it depends on what head we're using, but with the one that we are currently using, it's going to go about an inch into the skin and then be active from about an inch to 3 inches under the muscle or under, our targeted area. So really, you're not going to be ticklish inside of your foot. It would be more like surface area of the foot that you would get ticklish from. Okay, well, everybody, that was our focused shockwave treatment here today. A quick little plantar fascia video. If you want to try out the shockwave for yourself, or if you want to ever come into the office, say hey to us all, get an adjustment, come on by. Once again, we're your local Towson, Baltimore area chiropractors, Kalkstein Chiropractic. See you next time, everybody. Hey, everybody, this is Mike. Got the Focus Shockwave back at it with another video from Kalkstein Chiropractic, your local Towson, Baltimore area chiropractor. Today we've got a patient who is experiencing Achilles heel pain, so we're going to be focusing right there on the sweet spot today. This is just to showcase another form of treatment that we can do with our new focused shockwave. We have tons of Achilles and plantar fascia. We've got a lot of hip, we've got a lot of shoulder, and all of those will be treated today with the focused shockwave. We're going to document them with videos as well to just really kind of spread the knowledge of focused shockwave and what we can treat with it. With that being said, let's go ahead and get started. So we're going to first just go kind of lightly for our patient here. We don't want to immediately fire up this spot, but you can kind of see that swelling on the Achilles heel. You can see where our focus is going to be. We're just kind of priming up the areas nearby it, and I'm going to slowly start to increase our pressure as well. How does the pressure feel so far? Not too bad?
Not bad at all.
Perfect. So I'm going to go ahead and bring it up. Still feeling okay?
Yep.
Perfect. Now there is not a perfect answer for the pressure or the force that we're using. We just ultimately want to go for patient comfort level. You want to be a little bit uncomfortable, but we don't need the patient clenching for pain, starting to sweat because it's really hitting them. We don't need it that high. It's not a no pain, no gain situation. We just need you to feel a little uncomfortable to make sure it's working. So we're really just going to spend all of our time attacking our problem right here, which is this little bit of inflammation, a little bit of swelling back here on the Achilles heel. And you can see that on the video pretty well, that little bit of swelling. That's where we're going to send the majority of our energy today. We might dip into the heel just a little bit to see if we can find anything on that kinetic chain, but for the most part, we are going to spend all of our time right here. Because again, this treatment, this focused shockwave, it's really easy to kind of think of it as almost like a shot or a sniper rifle blast. So you want it right direct, you want it right on the problem area. Whereas that radial pulse, you'll kind of see a little bit more of that broad spectrum painting the picture sort of technique that we use. Now, has any area that we've hit so far been a little bit more tender than the other, or is it all feeling pretty good right now?
Some places a little bit more tender, yeah.
Okay. point one of those spots out to me.
You hit one just right there.
Right here? Perfect. Yeah, so what we're finding is that the edges, so up in here and up in here,
And on the other side, yeah.
are those really sensitive spots. So for the rest of the treatment, I'm going to really just kind of focus right here, and on the other side we might manipulate the angle, so slightly turning the handle piece, but for the most part we're going to stick right here and just send some nice energy into the region. So again, this is just a video that's really showcasing the variety of tendinopathies that we can treat here in the office with the focused Shockwave. And this is a good one because it's showcasing an area that would be a little bit too sensitive if we were to use that radial pulse Shockwave. Especially right here on the Achilles heel. It's going to be a pretty uncomfortable spot if you have that percussive sound wave. And since, as you can kind of tell from the video, it sounds much different, it's not a percussive sound wave with the focused Shockwave. We're using a tank of water to actually create that shockwave that's then traveling through, as opposed to the other unit that uses basically a magnetic bullet and a contact with a titanium or a steel plate. This is a little bit different. Really focusing now for the last of the video on getting just these sides hit.
Got another part right there.
Right here?
Yeah.
Perfect. Alright, so our treatment here is about to be done on this episode or on this video, as well as with the patient itself. So guys, if you have any sort of tendinopathy, if you've got any sort of pain going on, or even if you just want to come down, get an adjustment and say hey to everybody, feel free to come on by. Once again, we're Kalkstein Chiropractic, your local Towson, Baltimore area chiropractor, and we'll see you soon.
Hey, it's Nicole over here at Kalkstein Chiropractic. I'm here with Eddie. He's going to be doing some Shockwave on my calf and my heel for some plantar fascia. So we're going to go ahead and bust that out because I've been neglecting myself for too long. Are you ready, Eddie?
I'm ready. I'm ready.
I don't know if I am, but we are now.
Go ahead and raise your ankles up for me. And then lay them right back down.
Thank you.
Perfect. Let me see here. So you're having a lot of issues like on the lateral side?
Lateral side, and
Lateral
then
side.
the whole calf is just kind of done.
Okay, gotcha. Feeling a little stiffness here.
Yes. The calf is going to be really tight for sure. The foot, I'm unsure, but I'm sure it's also going to be not wonderful.
Awesome, thank you. Yeah, no problem. Love to see you. All right.
On the foot, you might find something more towards the toes too.
Okay.
I just don't know.
Gotcha, gotcha. We'll work everything out over here.
Yeah, what's that? Oh yeah, he was super funny. He was on the piano the whole time, just cracking jokes and playing songs.
Nicole, are you ready?
I'm as ready as I'm gonna be, Edison.
All right, let's get it started.
Okay, that's not terrible.
Not too terrible?
Nah, you could probably go up a little bit. Yeah, you can crank it a little more if you want.
Gotcha.
Yeah, that'll be it.
That's good. Gotcha.
Yeah, right down in there. Yeah, it's like all down by the ankle too. Is like where it's all so tight. Yep.
Right in here. Gotcha.
Not fun.
Nicole, you doing okay with this intensity?
Yeah, I'm okay. You might be able to crank it up a little bit.
Okay.
Just because I feel like I'm getting used to it a little bit. Yeah. Oh my goodness. You're right. It's all on that lateral side for real. Yep, in there. Yeah, go right in there, that middle.
Right in the middle. Yep. Now you feel it.
I like didn't even feel it until you hit that one part of my side, and I felt it go all the way through.
Yep.
Because those sound waves, when they travel, it's like you can almost feel where it wants to go too. Oh my goodness. Kind of wild. Whew. Yeah, we definitely need, I'm glad we didn't do focus. Because that would have been, oh my God. So fun fact, I have lesions, bony lesions on my ankles, so I feel like when I do the shockwave too, I feel it like a lot of increased range of motion in my ankle too. And I really would love to know if it is like helping with that lesion or not. I have to ask the docs and see what they would say. Oh my goodness. Whoa, what's going on in my calf? Yep.
A little too much?
No, it was just that lesion. I felt it.
Gotcha.
Yep. Like when you're in there, I feel.
Yep.
Oh my God. Ooh.
Nicole, you're doing great. Keep up the great work here.
Oh yeah, totally. Wonderful. Oh. That was crazy. Oh my goodness. My ankles are messed up too, so that's why.
We're almost done here.
I can breathe.
We're halfway there, Nicole.
Woohoo!
Alright, so let's
Yeah, I'm curious about my foot, I'm not gonna lie.
Yeah.
Because it's been a minute since I did my foot.
I don't know if they do like a lunch menu or not. That's like cheaper, but traditionally with Korean barbecue, it's one of those like.
My calf already feels looser, and I haven't even moved it.
Stay there the entirety of the time because that's like what you're paying for.
Just gonna go on to the ankle.
You want that.
Gonna lower down the intensity just a bit.
What do we want next, boys? Because like the whole time, you know, they're bringing out kimchi, they're bringing out like all the.
There we go. Let's get started.
Let's go.
just it's a communal thing. It's not like, all right, let's knock it out 45 and we gotta get back to the office.
Yeah, so you're right.
It's like, we're gonna sit down. Yeah.
Say Brett.
This is gonna be terrible. I already sense it.
You ready, Nicole?
I'm as ready as I'm gonna be. Ah!
Hold on, I'll cut that video real quick. Having a little bit of trouble with difficulties.
Are you switching the head for me?
No, what is it? Something inside. It's got a little.
Is it that noise?
Yeah.
Oh my god.
Oh shoot.
It's always that noise. I'm just trying to get some treatment. Carly's getting good CA content. Day in the life of a CA, the shockwave's making a funny noise.
Alright, here we go.
Oh my god. I knew it. This was gonna suck.
Right here.
Yep.
Gotcha.
Oh my. Oh yes. Fun stuff. I'm curious to see if you go on the bottom of my foot, like graze towards the bunion and see what that does.
Gotcha.
Oh my. Yep, right in there. I feel that in my bunion, but then also in all of my other toes. Oh my goodness, and it feels so good. It's like right in there, Edison, is where it goes numb. Every shift by 5 o'clock, right there is numb on my foot. I have no idea why. So, oh. Yep. Eddie knows. He's my bunion man.
Oh gosh. Oh, man.
He's like, please no. Sorry, Eddie. You done did it to yourself. Oh, yep. Oh my goodness. That's insane. Is my toe moving? Feels like it's moving. That was fun. Whoa. That's such an interesting feeling.
Feeling okay?
Oh yeah. I like it. Wow. Like it feels like it's totally working, but like in a way that I don't think I felt with the focus, because we've only ever done focus on my bunion. The radial, I don't know why. It's like similar but different. I feel like this is massaging it a little more, which just feels a little bit better. When I also feel what the focus was doing, that like stingy feeling.
Right.
Interesting. Wow. Thanks, Eddie.
Of course, of course.
Oh,
Here, let me clean you up here.
thank you so much. All right, people. That's about all I can handle over here at Kalkstein Chiropractic. We will see you next time.
Hey everybody, it's Mike from Kalkstein Chiropractic. We've got a patient here today that we're going to be doing some of our focused shockwave on. So we're dealing with two different problems here today. We've got right wrist and left ankle. The right wrist is a result of a somewhat recent car accident, and the left ankle is a pretty constant off and on problem that you've had ever since a pretty significant ankle rolling, ankle sprain, if you will. So we're going to go ahead and get right into it again with our focused Shockwave. Our patient here is not new to focused Shockwave. This is definitely something that she's gotten a couple times now. Is this third session, I want to say, for the wrist?
Yes.
Okay.
On this round. We did previous Shockwave rounds in it before.
Gotcha. How do you think it's reacting so far?
For me, especially right after the car accident, this was a game changer. I think I healed so much faster.
Perfect.
Two-two.
Now we're just kind of knocking out the rest of what's
Yep.
in there.
Scar tissue.
Gotcha. Like we've talked about on other videos before, the focused Shockwave is really good at not only removing scar tissue, it's really good at breaking down kind of any sort of tendinopathies that you may have. So, like we were saying, kind of right after that car accident, that's when you're dealing with just the inflammation in general from said tendinopathy. But of course, after a prolonged period, after surgery, etc., you then have the problem of scar tissue building in the area anytime you cut into the skin and make that incision. So, like I said, multi-uses, it's kind of the jack of all trades in that regards. So we love using it here at the office. Let's go ahead and jump in though. So I'm going to start you off pretty low like usual, and
Okay.
just like always, let me know as we get to, that 4 or 5 out of 10, and when we start to find some pretty good spots. So I know a lot of it's going to be
Yep,
kind of
right in there. You got it.
So is this already our 4?
That's pretty good, yeah.
Okay, perfect. Now, not as much on the sides, it's kind of right on the top. So when we're doing the focused Shockwave, we're not aiming for the most uncomfortable thing in the world. That's why I was kind of cueing that 4 or 5 out of 10. We do want it to be a little uncomfortable because this machine, the way it works, the energy is very pinpointed. So if you're not feeling that discomfort, if you're not feeling a little bit of pain, it's going to be tough for us to know we're truly on the right spot.
You're on the right spot.
Perfect.
Yeah, right there. Woo.
There we go. And sometimes even just changing the angle, like you guys saw on the video there, will make a pretty significant impact. So any plans coming up for this Thanksgiving?
Hanging out with the family.
Nice. This video will probably come out right around the time Thanksgiving drops. So that's a pretty solid question.
Yeah.
Are you all the families local? No
Pretty
travel at all?
Nope, no
Okay.
travel. Pretty easy peasy.
That's always nice to be able to see everybody and have minimal travel. Right there, Joanna. Okay. Yeah. So, unlike our other Shockwave, the focused Shockwave, while uncomfortable if it hits bone, it's not going to send that vibration up and down the entirety of it. It's actually very beneficial for fractured bones as well. So that's why we're kind of able, with such a bony region like the wrist, we're able to use the focused Shockwave and it not just be the most uncomfortable thing in the world. Now you can definitely tell from the reactions we're getting, it's not comfortable, but it's not the worst thing in the world.
Nope.
And we're already about to be done right there.
Yep.
We've got, I'd say, about 30 seconds left.
Okay.
I have a question. Hello.
Got a little dirt on my boots.
Hang in there for me. We're almost done. There we go.
All right.
All right, round 1 is all complete. So we're gonna go ahead and do a brief break while we get our patient here switched around in the bay so we can blast the left ankle. So we will see you guys back in just a second. All right, everybody, welcome back to part 2 of our video, our second round of Shockwave, and today we're discussing the benefits of playing soccer in your flip-flops.
Don't do it.
So that is ultimately what the ankle sprain is from, unfortunately. So we're going to be treating the ankle now. We have a little bit of a different head, like you can tell on the Shockwave. We need it to be a little bit more closer to the surface. We don't need that full depth or penetration that we could have with the other head. It's a little bit more superficial. So this is where we're at. I'm going to go ahead and start to turn it up just a little, okay? So it's kind of right around this region here, would you say? It's still not very strong.
Right there.
Okay. Is this too much?
Down.
Gotcha.
Okay.
So this might be too weak, but I kind of know where the spot is,
Yep,
so I'm going to
that's
turn
it.
you. Is that 4 or 5 though?
It's pretty good, yeah.
Perfect. All right, so I'm going to spend a little bit of time here, and then we'll move around. So do you have Thanksgiving week off?
We have a half day on Wednesday, and then Thursday and Friday.
Nice, okay. That's about what we have here at the office. We have Thursday, Friday off.
Nice.
I knew because working with kids, usually they have like the Thanksgiving breaks. That's what
Yeah.
I figured. It's not as much as we get towards the Achilles, right?
Correct.
Okay. But then when we come around to the other side, it's probably somewhere around there.
Yes.
Okay. So when we outwards rotate, I'm going to hit that part too.
Okay.
Right there a little bit? So we're kind of going around the entirety of that ankle. You can see it's a little bit swollen still around the bone itself. So that's kind of the guidance here. Not only location of pain, but we can kind of see the swelling as well. So that's how we're able to kind of see where we should really be focusing on. I'd wager there's probably a little bit right in there too. Yeah, because you can see right here. I'm not sure if that's coming up on the video, but there is still a little bit of swelling there as well. Okay, so just a couple more seconds and then we'll change positions and kind of get the other side there. There we go. And let me just wipe you off real fast. There we go. And if you want to go ahead and we'll take this. Yeah. We'll slide that under. Perfect. So again, that side, and then you were saying up the foot, kind of? Was that what you were
Right
saying?
under the bone, where the swelling is.
Okay, gotcha.
I usually have pretty bony ankles, just not right now.
Just not right now.
Not on that one.
Right. I'm going to start you off right at the pressure that you were at on the other side, but
Okay.
just let me know if that ends up being too much, okay?
Okay.
So let's... Oh yeah, that is pretty substantially swollen. Is that too much already? You want to turn it down?
No, I think it's okay.
Got it. Doing okay as we kind of go up here?
Yeah, I can go down.
Turn the pressure down?
Yeah,
I gotcha.
just one.
No worries.
In that one spot, yep.
Right in there? Okay. just had your ankle jump on me. I'm trying to find the spot that it was
Right
just
there.
at.
Yeah.
Yep, right there. Not only are we going off of patient feedback, but every so often when we cross a spot that there's a little bit of feedback, you know, you can kind of see certain fibers dancing around, and that's what I'm kind of getting. You can't really probably see too well on the video, but there's just a tiniest little bit of a twitch going on. Up here, not too bad?
No, not too bad.
Turn it down.
No, it's okay.
You okay?
I'm okay.
Are you just saying that because you're being filmed?
No.
Okay, maybe down one.
I gotcha.
Just in that one spot.
Yeah. So that was right
Yeah.
there. And we're almost done too. So maybe about 30 seconds left. Okay, so that was our 2 areas of focused shockwave treatment. Once again, we were blasting the wrist. That was a little bit more of a, I don't want to say acute, but not a super chronic problem. It was from a somewhat recent car accident. Now this, the ankle problem, far more chronic. So you kind of saw both windows. We can attack any sort of problem with the shockwave. Well, I don't want to say any problem, but tendinopathies we can do a lot to with the focused shockwave. So if you have any sort of chronic tendinopathy, if you have anything acute like our patient here today does, come on into the office. We don't advise you playing soccer and flip-flops, but if you want to do that too, you can end up on the table as well. So come on down, guys. We're Kalkstein Chiropractic, your local Towson, Baltimore area chiropractors. We'll see you next time. Hey, welcome back. I'm with Jayla. We're going to show you shockwave therapy, right, Jayla?
Yes.
This is what type of shockwave, what type of system do we have here?
We have the focused Shockwave.
Alright, so focused is different than radial.
Yes, it is.
There's different types of input you can use via Shockwave. There's a lot of different companies out there. This is a really awesome brand through Chattanooga. They did a great job of bringing this technology into our office, and they're the force behind the laser therapy as well as the radial Shockwave. I was exposed to a form of Shockwave at Walter Reed about 8 years ago, and that technology really didn't kind of surface with this type of acoustic and electrical components that we have now till recently. So this is very, very new. There's no offices in the area with focused. Focus has been really helpful for some of the deeper structures, and radial has been very helpful for more superficial things that we deal with, as well as trigger points. So for something that's deep, like a heel pad, I like both modalities, but I'm going to demonstrate focus today, as well as for some calf tension and Achilles tension that I have on this left side. What do I have again?
You have heel fat pad syndrome.
Ah, yeah.
There you go.
Fat pad
You can put your
syndrome.
leg down.
Yep.
Yep.
Common or not common?
It is pretty common. 1 in 10 people get it.
1 in 10 people?
Yes.
All right, so 10% of the population right now.
Yes, yes.
And tell me a little bit more about it.
So, heel fat pad syndrome is like the second most common foot sort of like injury or version of plantar fasciitis. Plantar fasciitis being the first one. And then this is the second one. And it's so common because our heels take a lot. It can absorb almost 1 to 3% of someone's body weight. So your heels are shock absorbents and they take on a lot. So when they're overused and taking on too much, that heel pad fat starts to decrease.
We can all take a page out of Jayla's book, staying on top and studious when it comes to medical conditions that come into the office. Just want to give her a shout out for the effort and the energy she puts towards patient care here.
Yes, researching always.
Always researching,
Yes.
always learning up on things.
Thanks to Dr. Warren, of course.
Listen, it's a team. And a really common thing, and it's a stubborn thing that we see. And the reason people get it is very, it can be diverse. We can get started if you're cool with that.
Okay.
Is that cool?
Yeah.
All right. Because I know I just saw Miss P just walk by. And I
Gotcha.
know she's waiting on focus for her hip, so I do.
Oh, yeah.
I don't want to hold her up. And I think Nick gave me the look like, hey,
You gotta get started. All right.
patient first. So
Okay.
we will do this real quick. I'll say this, the reasons people can get it, like you can have someone that has like a surgical intervention on the opposite side, and then they compensate, and then they kind of build that gait or that pattern over time, and then they start to stress one foot more than the other. That could be a way they do it, and it can be just habit as well. There's definitely some functional components that put people to stress one side more than the other.
I don't want to scare you. That's why I don't want to.
What, do you have this thing ramped up or something?
No.
Taylor?
Have you had this before?
Taylor's like, I got my review next week. Let's talk about it right now.
Are you ready?
Yeah. It's my second time getting it.
Okay.
And every time, wow.
See, if he was still giving his spiel, he would have had to stop.
I would have had a wow in the middle of that sentence. That's so crazy. It kind of blows my mind where it hits. It kind of reproduces the sensation when it's really irritated almost to a certain way. Or like at least it pinpoints where that irritation is. I shouldn't say it reproduces it, but pinpoints where it is. And it feels good.
Is that
intense right there. Holy smokes.
is that too much?
No, we're good.
Okay. I'm gonna hang out in this
Oh,
area.
you're going to hang out right there?
Yeah.
All right, Daly, you got it. It's yours. You got the raise, okay? So really commonly we see it, oftentimes doing light therapy and shockwave on it. So I think that if, and we're joking a little bit, right? But if you're someone that's dealing with plantar fascia, heel pad syndrome, heel fat pad syndrome, or Achilles tendinopathy, kind of all of these conditions kind of lie in that same field of, just say it for what it is, in lesser words, stiffness of the tissue, overuse, overstress of the tissue. And oftentimes when we take a technology like this, it gets in there and works it, breaks up scar tissue, stimulates cellular activity, stimulates stem cell activity, and then also on top of that we utilize light therapy to help with that proliferation of blood flow and the good things that happen when we're healing from something. Increase mitochondrial activity, all those things. We're trying to like work that tissue, we're trying to wake that tissue up, and then we're trying to remodel that tissue through proper movement and stretching. You going up to the calf?
Yeah.
Okay. No warning. I got it. Just going straight for it.
See, I didn't know if you needed that.
Jayla, I need that.
I thought you were a pro.
I have no pro.
All right. That feels okay there?
Yeah, I'm at a 1 out of 10 intensity.
Okay. You can go up a little bit. I'm gonna hit that Achilles now. That might be. Is that okay there?
You are good there, yeah. 2 out of 10.
Okay.
Jayla, what do we look for when we're hitting this?
We are looking for a 6 out of 10, no more than that.
Number 1. Why are we looking for that?
Because we don't want people to jump off the table, 1. And then 2, you still get therapeutic. It's still therapeutic if you go up to that pain threshold. We don't want it to be anything someone can't handle. All right, we have a little bit left. That was our safety break.
So it's dialed in for their comfort, but we also are getting some work done, huh?
Yes, absolutely.
So if I were to say to you, hey Jayla, I can't handle that, what would you do?
I would turn it down, or I would change the head to the focus shockwave.
Alright, so holy mother.
Turn it down.
No. I didn't say that. I call my mother holy. Saying hi to her.
What's that for you?
I don't. What's what for me?
What out of 10?
That's okay. Will you hit a spot on that a little higher and then go medial right there? You can hang out there. It's cool.
See, people say you can hang out there and then they're like kicking and stuff. That makes me nervous.
Well, you just have to get there. Then you're there, and then you just hang out, and then you breathe through it, and it's all right.
You want a little more?
I'm just a verbal guy. Sometimes I like to talk through things. Okay, Jayla?
Okay. You want a little more, Dr. Morris?
Yeah, I'm here for it. This is my first time I've gotten this on my foot and calf. I really want to know what it feels like. I want to experience it on this area. I've had it on my knee, I've had it on my hip, and I've had some people that are on it.
Oh, and just so you don't get confused,
I don't know what I was going to say.
Where do you feel this at? Do you feel it here or is it moving?
What moving?
Do you feel it like in a different area, like in your toes or anything?
Oh, my soul. So I like using this with light therapy, soft tissue work, adjusting the ankle, Brady adjusting my ankle, and then I will when I hit the pavement, start running a little bit more. I'll come in. It's going to be a little sore, but this is a really nice way of getting on top of it. I probably haven't had a consistent amount of therapy on it, but if I really am going to be training with this guy here, Team's 120, even though he's trying to beat me in the race, I don't know what that was about. Trying to compete. Say who has the better number? I don't even know. Where our team chemistry is right now is not great. We're going to work on it. Okay? But, yeah. So I'm going to get this once a week with Jayla, get adjusted by Brady along the way, and then that's usually how I'm going to manage this from a treatment standpoint. Once a week for 4 to 6 weeks, light therapy, PT along with it, soft tissue work and adjustments, quite a few different things, but it makes it speed up. And it's a really chronic, hard condition to treat, just like plantar fasciitis. So it just needs a little bit more work. It needs repetition. Wow.
Feel that?
I really do. My heel feels really good though right now. Like that first spot you hit. Right on. Ooh, right there. Do you feel that through the head, J-Lo?
I do, kind of sort of the feeling.
It's good. So, that is Shockwave, that's the adjustment, that's the Team 120, that's J-Lo who's just crushing the game of studying about different conditions, who's teaching me now at this point. Since the beginning, really. J-Lo, thank you.
You're welcome, you're welcome.
And then for our next video that we're going to be doing, we're going to be representing the sweatshirt on our YouTube channel. Not just the t-shirts, but sweatshirts too. And remember, all the proceeds go to Hunt's Honey. Shout out to them.
How's it going, guys? It's Dr. Nick here at Kalkstein Chiropractic, your Baltimore area chiropractor. And today, I am getting treatment from Mike.
Hey, everybody.
Mike's going to do some shockwave on kind of my lateral leg down here. You'll see a little bit more once Carly kind of swings around. But I've been running a little bit more. Maybe jumped in a little too quick, or I'm just poor at recovery. But it's been giving me some issues down there. So Mike's going to help me out with the shockwave, get it feeling better, and hopefully I can run.
All right, let's get it started. Welcome back, everyone, to my conquest to shockwave the whole office. We have Dr. Nick today, and we are going to be blasting a very fun spot for him. He's going to enjoy this a lot. So we're going to start off pretty light, like you guys all know. But you can see we're kind of getting a little bit of a twitch response in his toes. So I can tell this is a nice spot to go ahead and turn the pressure up on. So Dr. Nick, let me know when we're about at that 4 or 5 out of 10.
Say right there's pretty good.
Perfect. Alright, so let's get right there and see if we can manipulate this foot a little bit and increase the intensity. Does this make it a little bit?
Oh, yeah.
Yeah. So let's pull it back and let's kind of go back in there and see if we can find some other spots up a little higher too.
Oh, wow, that's too much.
So let me turn it off. We found a real good spot there. We're going to just change the head that we're using. So this is our our widest diameter head that we have for the Shockwave. We're going to just change it to a little bit smaller of a diameter, and just so you guys can see the difference. It's a 20 millimeter versus a 15 right there. They're both steel-tipped heads, so intensity-wise and how deep they can get is exactly the same, but we're just not going to be as wide, so we can kind of avoid these two bones right here a little bit better.
That's too much.
That's still a little too much.
Yeah, that's right on top.
Let me turn you down a tad, and then I'm going to bring it back over.
No.
Okay. Lower him a little bit more. And let's see. Is that better, Dr. Nick?
Yeah. Guys.
That's the spot right
That's
there.
the spot.
Gotcha.
So don't... I'm a baby when it comes to this. So don't think this hurts too much. I'm just a wimp.
Now we do want to be at about a 4 or 5 out of 10 pain pressure threshold, so you know it's gonna be a little uncomfortable for Dr. Nick. There's gonna be times like right now where he's just got to ride that lightning, but we're gonna get him taken care of. Again, just for the audience, this is definitely one of the more bonier structures because we've got these two nice big bones right here, and there's just not a lot of tissue right in that spot that we were just blasting. So, you know, that's going to definitely add a little bit to the discomfort. Now, as you can see back here where he's got a little bit more tissue to play with, it's not as bad, but once we jump into this spot here, we're going to want to lower that pressure down because it is going to be, you can see, it's uncomfortable. Now, we get a lot of good results with the Shockwave because like we've talked about before in videos, you know, we're breaking down cells, so that is going to be a little bit destructive by nature. But especially in the case of Dr. Nick, this is just going to help him in his recovery and getting back to running a little bit faster, a little bit easier into that curve.
I'm good, but once you start getting more lateral, that's when it really starts to get me. I don't think I've sweat this much a day in my life.
Alright. Yeah, we're going to spend some more love back here, kind of let him ease into it again. And we're really just focusing on the entire tendon that's right here. Now again, this is a running injury for Dr. Nick. He's kind of jumped a little bit too into the deep end with his training regiment.
Shout out to Charm City though. They hooked us up.
Yeah.
Me up with some nice running shoes.
Charm City did something really nice for all the doctors, did something really nice for all of our patients, and we're getting a nice little partnership out of everything, so we're really excited for that. Shout out to Charm City again. If you've ever gone to Charm City and bought anything in terms of shoes or running equipment, leave us a comment and let us know what you've purchased. Maybe we can start to do some videos with the Charm City guys as well. Maybe we'll get them on the table next.
We do. We need to show them some TLC.
Give Dr. Nick a break. Am I right?
Oh, I'm going to have to put deodorant on again.
All right, everybody. We are all done with the Shockwave treatment today. The average length treatment is anywhere from about 3 minutes to 15. For Dr. Nick, he was just shy of 9 minutes, and I don't think he would want any more than that. You know, once again, follow, like the channel, come join me on my conquest to get everybody in the office. We're going to get them all squirming. Dr. Warren, you're next. Take it later, see you later, everybody.
Bye, guys.